Pat Checo is a patient of mine who I've been following for a number of years. Pat has a chronic autoimmune hepatitis with resultant fibrosis and portal hypertension. A couple of years ago, Pat had an upper intestinal endoscopy, as all patients with this situation should have. All patients with portal hypertension need to be checked for esophageal varices, and an upper intestinal endoscopy in the past had revealed small esophageal varices. Unfortunately, Pat didn't have a very positive experience with that upper intestinal endoscopy, which was performed by a different gastroenterologist. She's extremely reluctant to undergo a repeat upper intestinal endoscopy.
A couple of years ago, I had to have an endoscopy, and the whole thing from start to finish was pretty uncomfortable. They gave me enough, I'm not sure what the drug was, to just relax me, but if I didn't have the nurses there holding me down, I would have gotten up and walked away. And afterwards, I had a really bad sore throat for about 3 days. And as a result of that, I didn't go back to the doctor. He wanted to just see me in 2 weeks, and I just said I wouldn't do it again.
I was able to talk Pat into coming in for a PillCam ESO, just because it's non-invasive, no sedation involved, and given her negative experience that she's had in the past, I knew she'd never go for another upper intestinal endoscopy, so we'll proceed on with PillCam ESO today.
I was happy because I needed to go have it done, and I just didn't want to have the regular endoscopy.
Does the flashing end go in first?
There's two ends. Watch this. Okay, now just you could take the PillCam out, yeah, and put it in your mouth. And take a sip of water, and just swallow it down. Went down?
Yep.
Okay, now we're going to give you another sip of water, and we'll do that every 15 seconds.
Okay.
That's pretty easy, huh?
So take a sip now?
Yeah, take a sip of water.
I can't feel it at all.
Okay.
Oh.
Take another sip. Pretty amazing, huh?
Yeah, it is. It's a lot. Forget that other thing.
Forget the other thing?
Forget that.
Easier than the endoscopy Dr.
gosh.
Wasser did on you?
Oh, yes, yes, yes. Yes, that was unpleasant.
Ben, how easy was that?
That was pretty easy. Pretty easy.
Really?
Yeah, it was.
Really easy. Like,
I would have told you.
oh, yeah, I know you would have.
Yeah. So this is really exciting. As I showed Pat, the clarity of the images are absolutely stunning, breathtaking images. The PillCam ESO diagnosed esophageal varices, which we knew she had, and by strict criteria, she still is in the C1 category, the small esophageal varices, not quite making that 25% of the circumference for a medium or large varix, so-called C2, on the new grading scale. And basically all we're going to have to do, that we have to do with Pat is continue to monitor her with follow-up endoscopy or PillCam ESO, and I think that after today Pat will choose the ESO, but I don't want to put words in her mouth.
It was very easy, and it was better than I had hoped for. I had a little, I was a little nervous about swallowing the thing, but it went right down, no problem. No choking, no gagging. I could feel it maybe a minute into it with some water. You could just, it was just a mild, like when you swallow a pill sensation, then it was gone. The rest of the test, I didn't feel anything at all. I don't feel anything right now. I know I have to have another endoscopy in the future. 2 years, maybe 3 years, 4 years. No, in a couple of years. And I'd much rather have the PillCam than the old procedure. And there was no problem swallowing it. There was no gagging, no choking, nothing. didn't feel anything at all, just with a few sips of water. It was great. My name is Pat Checo, and I'm 54 years old. I know I have to have my esophagus checked on a regular basis, and now that I've had the PillCam done, I'll never be afraid or nervous to have it done again.